Good afternoon, everybody, and welcome to the COVID-19 webinar. Let's get started. Let me go ahead and share my screen right here for everybody. So let me go ahead and make this presentation a slide for everyone to tune in. COVID-19, the pandemic happening right now in 2020. My screen is kind of moving kind of slow today, but technology. So here we go, COVID-19. So I'm going to take my link and I'm going to take you right to the website of it and kind of explain to you thoroughly about COVID-19 and what's been going on. So we're going to start off on how to protect yourself. So how to protect yourself. As you can see right here on your right side, it's talking about older people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing serious complications of COVID-19. And more information are higher risk for serious illnesses. So I'm going to click here in this link to kind of give you a brief illustration. People 65 and older, people who are living in nursing homes or long-time care facilities. And then they're going to talk about people of all ages with underlying medical condition, particularly if not well controlled, including people with chronic lung disease, who have serious heart condition, people who are immune uncompromised. Many conditions can cause a person to compromise, including cancer treatment, smoking, bone marrow or organ transplants, immune deficiency, poorly controlled HIV/AIDS, and prolonging use of oral steroids and other immune weakening medications. People with severe obesity, people with diabetes, people with chronic kidney diseases, and ongoing dialysis, people with liver disease. All of these things are a factor. Older people, people with asthma, risk of severe illnesses, people with HIV, people with liver disease, people with incapacities. These are some of the things that you can see right now. And here's a video that ties into this. I think I might have it in the presentation again. I'm going to go ahead and show it here, and it might show up again in the presentation. All right, everybody. And people all As you see, the CDC is basically giving you regulations and things that you should do. And it goes on how to protect yourself. So everyone should wash your hand, of course. Use hand sanitizer that contains at least 60% alcohol. Avoid touching your eyes, your nose, and your mouth. So when you're out at these different stores and also out at these different places, make sure you try not to touch your eyes, your nose, your mouth, because germs are spreading. Avoid contact contracting. That means 6 feet apart. That means if somebody is sick or you have people in your household who have low immune system, please refrain from being close to anybody. Put this between yourself and other people outside of your home. Remember that some people without symptoms may be spread of the virus. Stay at least 6 feet and please keep 2 arm lengths from other people. Keep distance from other people, especially important for people who are high risk of getting sick. As of those who have high risk disease like diabetes, cancer, if their immune system is really low, make sure you do that. And they encourage you to wear the face mask. I know a lot of people have an issue with the face mask because they may have underlying health issues. But by all means, please keep yourself covered. Please do all the things. If you don't like to wear a mask, make sure you take your vitamins. Make sure you take all the stuff to keep your immune system above. Make sure you wash your hands. Make sure you wash your face. Make sure you change your clothes. Make sure you do these things to make sure your household is not exposed to this deadly disease. All right. There's some of the things that you should know. Everyone should wear a face mask, but a lot of people don't wear a face mask, and that's a big issue. My advice is to make sure you take your vitamins. Make sure you stay 6 feet apart. Make sure you keep your immune system as up and as powerful as much as possible. That way you can avoid it. And as long as you keep yourself hydrated and keep yourself tune in with your body and make sure you check your body and make sure that, okay, am I feeling all right? Is my health okay? Am I feeling the right way? Am I washing my hands? Am I keeping myself sanitized where I'm out here exposed to these different things where I'm going to? Just protect yourself as much as possible, okay? Cover coughs and sneeze. If you're around others and do not have a cloth, face covering, remember to always cover your mouth and nose with tissue when you cough or sneeze. Use the inside of your elbow and do not spit. Throw used tissue in the trash. Do not throw it on somebody's chair or put it somewhere where people can touch because people are not aware. A lot of times they want to touch this. Immediately wash your hands with soap and water for 20 seconds. If soap and water is not really available, clean your hands with the hand sanitizer that contains 60% alcohol. So if you need some hand sanitizer, make sure you purchase that in soap because they have a lot of it on the shelf now. Don't just walk past it and pretend like you see it. Do it. Clean and disinfect. Disinfecting cleaning is very important, very essential, and you need to make sure you clean tables, your doorknobs, your light switches, your countertops, your hand desks, phones, because germs lay on anything. If the surfaces are dirty, clean them. Use dish detergent or soap water to prior disinfect. Then use a household detergent. Most importantly, and they're going to give you a list of that. Monitor your health. Be alert of symptoms, which is like fever, cough, shortness of breath, or other symptoms with COVID-19. Especially important if you're running an essential errand or doing stuff in your workplace. Make sure you take yourself as much time. Take your temperature if you develop symptoms. Don't take your temperature within 30 minutes of exercise or taking medication that can lower your temperature. Like what is this? I think this is like aspirin, I believe, and follow the CDC guideline if you develop symptoms and stop the spread. Here's another video that I'm going to show you before I go back to the presentation. So pay attention, everybody. This video is COVID-19, stop the spread of germs. All right, this video is talking about COVID-19, stop the spread of germs. The next video I'm going to show here is going to be the video about how to wash your hands. The videos that I'm showing here are not very long, so they'll get right to the point. As you can hear, or you can't really hear, you can basically read the content of it. Basically, it's telling you 60% of the alcohol on this. As you look at the video footage of it, it's tell you how long to scrub your hands and wash your hands. It's talking about for 20 seconds to do that. It basically talking about go inside your fingernails and get all the germs and anything under that. That way you make sure your hands are clean. And it says use a towel or air dry is either fine, but if you're using towels, make sure it's clean. Should I use paper towels to turn off the faucet or open it? And they're basically telling you at the bottom of the content that either or, apparently. Oh boy. Oh. So basically, the CDC is basically giving you guidelines on how to protect yourself during this COVID-19 epidemic that's been going on. I'm going to go back to the beginning of it, to the website, and then when I go into the part of it, I'm going to illustrate and identify some things. Now here, this link is talk about what do you do if you are sick. So when you talk about these things here, here's are some of the things that you should do and to basically protect yourself when you're staying home. Staying home, expect to get medical care. Stay at home, take care of yourself, stay in touch with your doctor, and avoid public transportation, riding, or sharing a taxi. Separate yourself from other people, of course, and basically just stay isolated and quarantine in those processes. Monitor your symptoms. If any of these symptoms start to progress, make sure you seek medical attention immediately. Trouble breathing, proceeding or pain or pressure in the chest, new confusion, ability to walk or stay awake, blistered lips or face, and this list that is not possibly symptoms. And there might be other things that goes along with COVID-19 that might not be on the list. So you make sure you keep a tune about what the CDC is talking about and some of the things that are keeping, and keep yourself informed by different symptoms that you didn't realize as part of COVID-19. Call ahead. If you have medical appointments that can't be postponed, call your doctor's office and explain to them what may be going on within you. And if you're sick, wear covering over your nose and mouth. And a lot of people don't want to participate in the whole cup because they feel like it's really a control thing. At the end of the day, you make sure you just protect yourself as much as possible while dealing with the pandemic and dealing with things that's going on out here right now, this very moment. And do that to protect yourself and protect others. It talks about cover your cough and sneeze and cover your mouth and nose with tissue when you cough or sneeze. Throw away using tissues and a lining trash can. And immediately wash your hands, of course, 60% alcohol. And washing your hands and your face and changing your stuff is very important. That keeps you from putting things in your eyes. And you didn't realize that you can get COVID in your eyes simply by rubbing it and being exposed, because your nostrils is absorbing so much stuff that you're dealing with out there in the world that your eyes can get that too. And I seen an article about that, and I was completely shocked at the fact that your eyes can get it as well. Yeah, your eyes can really get it. Avoid sharing personal household. If you have this thing, make sure you don't share dishes, drinking water cups, eating utensils, none of these things, because you don't want the whole house to catch it. And you don't want people around you to catch it. That means the whole house got to be quarantined for 14. And cleaning is a very high priority every single day you're going out to these places. And clean this area of blood, stool, or body fluids on them. So whatever it is that, like I said, you're around, these are some of the things that you should be a lot aware of while going through these. And when it's safe to be around others after being sick with COVID-19. So here's a link I want to share with you guys about when is it safe. So when, they want me to do a survey. When you can be around others. In-house out depends on different factors of different situations. Find DC recommend for your situation. 3 days with no fever. Symptoms improve in 10 days since symptoms first appear. So what you want to do is, ladies and gentlemen, after the fact that you have went through this ordeal in your life, you have to be careful what you're doing and make sure you get retested, and also get ahead and get the antibodies tested to see how your count is inside your system. That way you know how to maintain your diet and maintain certain things to kind of get to a normality in your life, but being careful and still being aware about what's really going on. So with that being said, after you quarantine and went through the whole process, and make sure that your immune system get back to a norm, and make sure too that you are very mindful and very careful on who you're interacting with and being exposed, because you can't get the thing again. Okay, so make sure you continue to talk to your officials in the medical position to make sure you're making the right decision and the right choices and stuff. And make sure you talk to them to see if you can turn back to work, or whatever your position it may be. Maybe you can work 2 days, maybe you can work 3 days, maybe you can work on the weekends, and you'll be in your own little office where you're not around anybody. And that's just some things that you should think about. So in the next content, and I'm going to show a couple of videos, and then I'm going to go back to my presentation. And these videos are like really short here. This video talks about, I think I know I had COVID-19 and I had symptoms. When can I be around other people? And there's another video, 19 minutes, 19 seconds, I believe. It's basically saying the same thing. It depends on different factors and different situations, as I'm reading on here to the right. It depends on how your circumstances may be and how you may feel after going through the whole isolation and all through the process that goes along of coming out of the COVID-19 epidemic. So as I fast forward, I'm going to talk about the testing part of it and then go back to my presentation. I just want to get some of these key points out there for everybody doing this webinar to kind of get you to understand. So testing for the COVID-19. So here we go. So a visual test tells you if you have current infection. An antibody tells you if you have previous infection. An antibody test may not be able to show you have current infection because it will take 1 to 3 weeks after infection to make antibodies. We do not know yet if having antibodies to the virus can protect someone from getting infected with the virus again, or how long that protect might last. Who should be tested? Everybody should be tested. Nobody should be excluded. You got a mild illness or something that's going on, everybody should be tested for the COVID-19. Everybody should be tested. If you have symptoms, of course, you want to get tested and call your healthcare provider first, and then make sure you have all the supplies and everything you need when you're going through it. If you test positive, they're going to contact you and explain to you what the protocol you should be. And if you come back negative, you're not infected at the time, and that means you're in the clear, but you still have to protect yourself in the process. So as I go along and just let you read through the content of everything that's being said, you can look at the healthcares and the professionals and the laboratories and all of this good information to explain to you about how to protect yourself doing this. And here is another link that talks about your current. So here's a self-check. So they have it on the CDC link where you can check this box here to see what your next steps in doing and how do you go by doing this. And just read through the content of it, and it explains to you in thoroughly. And every state may have different rules and regulations on how they're doing these different testings. So make sure you click on the states and the locations and see how they're handling and what days and what time they're doing the testings. Okay, everybody? So let me go back to the site. And let me go here, and here's testing, facts, answers, and questions. And then basically you can type in what you're looking for on the website, and it'll basically give you answers to certain things that you're doing. And it has different things you may have answers for and things that you may have to understand. And then test for the past infection is talking about how test for the past infection, antibiotic tests. So whatever the results may be, you go by that and how you can go into the next step and what next procedures that you need to do to prevent this from happening yet again in your life. So going back to the presentation, we're going to talk about this procedure here, and we're going to talk about COVID-19. What are some of the warnings for everybody? So here we go. So let me do it this way, and let me play it like this, because the presentation just basically kicked me out of it. So I'm going to let you listen to what he has to say in this content. How COVID-19 can be moving on to my next presentation. What are some of the stay-at-home orders? So as I click this video, ladies and gentlemen, I want you to kind of just really absorb the information that is being shared during this COVID-19 presentation that I'm presenting today. Stay away. Oops, sorry, y'all. Well, I guess it start over again. All right, here we go. We're gonna get a recapture of it again. So as you can see in this video, it's basically giving you 10 tips to use in a stay-at-home order. Now I'm moving to the fifth slide of this, and it's talking about it's talking about what older people need to know. And this is like a 2-minute and 26-minute video, and then it's going to talk about the anxiety and stress. And then the last two videos is going to talk about the kids, excuse me, and it's going to talk about just general information for everyone to understand. So pay attention. All right, everybody. That was basically giving you some helpful tips being an older person on how to handle COVID-19. The next video I want to share with everybody is talking about anxiety and stress.
Oh my God!
Nathan? Shh. That is very informative. The video you just looked at was talking about anxiety and stress and the support that you may need while going through COVID-19. So the next slide is going to talk about the symptoms that are hitting the youth. And the symptom that is the new inflammation symptom affecting kids diagnosed with COVID-19. So this video here I'm going to share, and then I'm going to get into the last PowerPoint, I believe. So attention, ladies and gentlemen. Let me see if I could turn it up a little bit, everybody, because it's up high, so you can barely hear. Hmm. Mhm. And that's something I want to talk about after they get through talking about this. All right, everybody. As you look at the video of the doctor and the reporter for Channel 3, and basically is talking about the different symptoms of the COVID-19, and then they also talked about the things you should be aware of, and just basically different things you should pay attention to. In terms of the concept about kids returning back to school is like the biggest elephant in the room. And I'm going to sit here and talk about this very briefly before I get to my next slide. Honestly, truthfully, if you have children with very low immune system and they're easily getting sick, I advise you not to take your kids back to school on this simple matter, is simply because they will track something that they don't want to have in their life. And I believe true enough that a lot of parents want their kids to go back at some point, but they want to make sure that this virus is contained and this virus is in a place where it is at an admission where they shouldn't fear about their son and daughter going and contracting this thing and come back completely sick. It's just like when you send your child to school and this whole epidemic of the flu outbreak was going on. You're concerned with that. Well, this is deadly as well as flu and any type of diseases that is out there that is so bad that you have to be concerned about it. And by this going on for the last 3 months, ladies and gentlemen, this really makes you wonder, because we're in June now. This is June 18th. And school is probably coming back to session August, early August, late August, September. And this is a concern for many guardians and parents that they have to get the reality that, hey, school's going to open back up. How do I feel as a mom, a dad, and grandma, and grandpa, whatever your role may be? This is some of the ideas and things that's going on. A lot of parents have made up their mind, our child is not going back to school until this virus is in remission. My child is not going back to school until this virus is not in existence. And I tell you this is because it's a problem now, and a lot of parents have made up their mind before even August has hit the platform that they're not sending their kids back. And there's some parents that are going to take a chance and send them because they got to go back to work, and they have nobody that really is going to support them in terms of taking care of their kids while they're working. They've done it throughout the whole 3 months in the end of the school year in terms of doing homeschooling, but they cannot do this because they have to pay their bills. They have obligations. They have to meet outside of the home. Ladies and gentlemen, this is very challenging and difficult conversation we should have with our families and decisions that need to be made based on the resource and the numbers and the statistics that's being poured out each and every day. So as I get to the last slide, this here is talking about children with MIC COVID-19. So I'm going to go ahead and share this video with everybody. And I believe this video is probably, I want to say, let me go back to the beginning. I want to say this video is short, but let me see what it really is right now at this very moment. And as it buffers, there we go. As the Universal Hospital just basically explained to the people in their professions about the MIC COVID-19, basically just giving parents some awareness about this. It's very, very key as us as parents and guardians to be aware of some of the symptoms and things that goes on with our children. So in the last part of this, talking about the character and sounds and signs of the illnesses. This is the last video of this webinar. And I believe it's pretty short. So it's basically going to explain to you very thorough what you really need to see. So in this last video, this doctor talked about the carrier and the signs of the illness. So as I conclude this webinar for COVID-19, I hope that the information that was shared today is very useful and very informative and to help you overall. Again, my name is Patricia Johnson, and thank you for tuning in to my COVID-19 webinar. I hope you were very informed and aware about some of the things you should be doing right now at this very state in the epidemic, pandemic that we're in right now. Everyone have a blessed and safe day. Take care.